Hi there, good morning. I'm Denise Plant. Welcome to Colorado and Company. I hope your Wednesday's off to a wonderful start. This morning, it's time to face up to your desire to rejuvenate your face while giving you the look that you've always wanted. Dr. Jeffrey Raval is a facial plastic surgeon and medical director of Rocky Mountain Laser Aesthetics. He's located in Cherry Creek North. Dr. Raval's office offers the latest cosmetic surgery procedures with a professional staff and a full-service procedure. Today, he has brought some great news about the injectable fillers and the liquid facelift. It's really the same great filler, but there's much less pain during the process. Carol is here to demonstrate the treatment for us today. Nice to see you both.
It's good to be here.
So what's the greatest fear that most people have when getting something like this done?
You know, well, one of the greatest fears is the discomfort or the pain. Everybody's worried about the injection and how much it's going to hurt. Other things that are concerning are bruising or just that it may not look right. So we've done a few things to actually help with the discomfort and the bruising.
What have you done?
So the filler is the same filler as it's always been. And the company actually itself has added Lidocaine, which is a numbing agent. It's the same stuff that you get when you go, let's say, to the dentist, like Novocaine.
Oh, good.
We've gone a step further, and we've added a little bit more lidocaine to it, and then we've added something else called epinephrine, which is like adrenaline, and that helps with the bruising.
And this gets better results.
Yes. So what happens also is by adding more fluid to the injectable, it actually thins it out a little bit. Now, you still get the same amount of filler, but because it's a thinner injectable, you get fewer episodes, less lumpiness, less unevenness, because it just goes in a nice, smoother fashion.
And I always say you have to go to the right doctor who knows what he's doing to put this in to make sure it looks natural. 303-381-FACE, that's 303-381-3223. You're going to actually show us a demonstration on Carol today.
We're going to, so first of all, I'm actually going to demonstrate how we do this. I'm going to actually slide this coffee table this way. And
so you're going to mix the lidocaine with the Restylane.
Right. And this is Carol, by the way. I'm sorry to introduce you. And she's been gracious enough to volunteer to let me do the treatment on her today. And
now, Carol has a very similar facial structure like I do.
Yes.
And I just recently had this done too. No bruising at all, but it's right here in this area to kind of fill it out a little bit. Correct.
So as we all get older and we lose, so we're thinking about volume loss over time, but gravity also pulls things down. And one thing that people come in concerned about is the jowl area, which is this area right here. And what I tell people is this, yes, gravity is kind of pulling this down a little bit, and that's treatable with surgery and so forth. But another thing that's occurring that makes it that accentuates the jowling effect is the volume loss in what we call the pre-jowl area right here. And if you can fill this area in by the simple office procedure like we're doing today, then you can smooth out the jawline better, and you could maybe delay surgery or more invasive procedures down the road.
And is it true, I know we've talked about this earlier, it was my left side, and I think you're going to do her right side today?
We're going to do the right side on camera, and then we're going back to the office, and we're going to finish and do the left side at the office.
But some people see a difference in the left side. I don't know why that is, but there's always a little bit of a difference in someone's facial structure,
Yes,
right?
And the left side usually is worse. The thought is, the theory is that the sun, when you're driving, hits the left side of the face more, and it just tends to cause it to age further, which, you know, we can throw in. That's another great reason why you want to wear sunblock, because the sun can age the face.
Do damage.
So,
all right, back to what you're doing here.
All right, so here's the lidocaine. We've already drawn this up at our office. It's a lidocaine with epinephrine mixture, and we have our Restylane here, and it's a Restylane L, which means that it's got the lidocaine also with it. And here's the actual syringe, and this is how we mix it. So we actually get the filler, and we connect these two together, like so. We place the Restylane with the lidocaine.
Really makes a difference. It's numbing the area, and this also helps. You don't have to worry about bruising as much.
Bruising, and it also thins out the injectable, so it's a smoother injection as well. So really 3 benefits to mixing them. And then then we just go back and forth with the mix. So we're just going back and forth until we have a nice mixture of both the Restylane with the lidocaine and epinephrine.
Okay, now while you're doing that and he's getting prepared, Carol, why did you choose Dr. Raval?
Well, I think I totally agree with you. You've got to research the physician that you're going to use, because that is the most important part of this. Someone who does it a lot and who has you know, good track record.
Right, great
And
reputation.
Carol found me on goodlookingdoctors.com.
Yes, I did.
Yes, that's where she found me. I was right there.
You
on the
know
homepage.
somebody's going to be
Yeah,
at home right
yeah.
now going, oh, I'm going to Google that too. You can actually go to ravalmd.com, that's his website, or 303-381-FACE. Are you nervous at all, Carol?
No, I'm not actually.
Okay.
Okay, so, and then a bunch of great things. Like Restylane now has a new needle that's much smoother. It's much, it glides much better. It's much sharper. Believe it or not, the sharper the needle, the less pain. So, here we are right here with Carol, and it's the pre-gel. Can you, is that seeing okay?
Yeah, we're getting a close-up here
Okay,
for
and
you.
and she's already been wiped off before the show, so I just want to let everybody know we did clean her off.
Okay.
And we just come in, and we've put the filler into this pre-jowl area. And so it's right in front of her jowl.
And it's permanent, and it is, well, it lasts for how long? A couple years?
You know, it lasts about 1.5 years, but there's some recent studies that show that the filler actually stimulates what we call this collagen in the skin, the dermal collagen. And the dermal collagen has a half-life of 15 years.
Wow.
So what we oftentimes notice is that people will come in a year or two later. And that's pretty much it. We can do a little bit more up this way, but you can see minimal bleeding.
Instant results.
Not too bad. Carol did really well. So now I was saying dermal collagen can last up to 15 years. So even though the filler may go away, it stimulates collagen production that can last a very long time.
I got this done on Friday, and I was back on the show on Monday, so no bruising whatsoever. Let's look at your pictures again before and after Dr. Raval here of some other patients.
Yeah, so these photos also show everything that we have to offer at our clinic. So laser treatments, filler treatments. She's also had some Botox around her forehead and around her eyes. And you can see after adding some volume, she's a runner who's been out in the sun a lot. She runs 8 miles a day. You can see she has some sun damage that the lasers were able to take care of. Also with the low body fat content that she has, the loss of volume does make you look older. So
Sure does.
people who are in great shape tend to need some volume to keep that younger look. Another patient also lives up in Winter Park. I'm sorry, not Winter Park, Steamboat.
Wow.
And again, very active, low body fat, sun exposure, laser peels, Botox. Actually, I think she got Dysport and some volumizing with Restylane.
Really great job. And Carol, you look beautiful.
Well, thank you.
Always do a little bit at a time. Nobody knows, and you got to choose the right doctor. Thank you, Dr. Raval.
Oh, thank you.